I'm Gabe Garcia. I'm the Dean of Admissions for Stanford University School of Medicine, and I'm very delighted. This is my 11th time at this meeting, and we helped get it started. So I'm delighted that you're all here, and I'm glad that you still support this effort. And I assume that since most of you are here, because you're interested in medicine, that what you want to hear about is what do medical schools look for in an applicant. And we're going to spend some time talking about that. I like my sessions to be interactive, so I may call on you, even though it's a big group. And if I do, just be nice and answer, okay? Even if it's just raising your hand. So who is this woman? What does she do for a living? Una curandera. So what do they do for a living? And just by looking at this person, how do you know that they're a healer? Huh? In the way that she's looking at the person in bed, looks like somebody who's sick, right? And what else? Looks like she's using some of her tools, some of her medicines, right? So there's some medicines lying around. What else? It's in a very sort of intimate environment, right? It's someone's bed at home with a child nearby. Okay. And how is a doctor different than a healer then? We're not so much, right? So our job is really to heal, right? And we heal in a different way. We heal because we have also this biomedical sort of information, and we have this amazing sort of training in basic sciences. But ultimately, what we're going to be good at is establishing a relationship between ourselves and our client, okay? And in establishing that relationship, we're going to use the tools of science to help that client be better. And perhaps that may be not the traditional tools, but the tools of modern science that allow us to distinguish ourselves from healers. But in some ways, if I am seen as my patients, by my patients, as a healer, I think I am successful. Okay? And so we're going to select people. By the way, this is the artist. Her name is Carmen Garza. She's from Brownsville, Texas, and she paints about her childhood memories. So let's frame our discussion by this. So how many premature deaths do you think will be prevented by universal access to effective health care, which we will approach if Obamacare gets funded, okay? So starting next year, we have the capacity to approach universal health care, except for people who aren't undocumented and all those people we really should support as well. How many preventable deaths do you think that will do? And I'm going to give you a choice. How many think 10%? Okay. How many think 50%? You got to vote to be part of this, okay? Good, okay. How many think 90%? Okay, good. So you know that the right choice is 10%. Because again, as I stated before, health is about your neighborhood and your circumstances. It is not about your health care. Your doctor tells you you're sick, but you came sick, okay? And so what we need to do, if you really, really wanted to affect the health of your population, you have to do both health care well and health well, okay? And so we're going to choose students who are going to enter our profession who understand how to care for patients one at a time and understand how to look for root causes of their problems and address those root causes as well. Okay? So we're going to look for people who do both. And I'm not just saying that. This is the work that I referred to before by Geberding, which essentially estimated sort of that access to healthcare is really only 10% of the solution, that everything else is what's important. So it went all the way to the end. So let's start. So schools have mission statements, and those of you who were in the panel that I spoke heard about looking at the mission of the school. So I want you to read these mission statements and tell me how you think these schools will choose their candidates. And these are 3 mission statements from real medical schools in California. Okay, so if you see these as statements of values for the school, the things that the school holds dearly, do you think that the schools that have mission statement 1 are going to choose candidates for the school in the same way as mission statement 2 or mission statement 3? The right answer is no, they won't, okay? And so what you need to do is not only look at the mission of the school and say, is this what I want? Is this the flavor of medicine that is in my future? Okay? And the very important part is, what are the programs and what is the access to the programs that I will have as a student that will allow me to engage in projects and learning along the mission of this school? Okay? So it's very nice to have a statement, and many of us in the panel were thinking, yeah, everybody's got a really nice statement. It's all about leaders and it's all about transforming. Okay? But in what ways and how will we give you opportunities to train and be effective in those ways? Okay? So this happens to be our admissions guiding principle at my school. So we'll admit a diverse body of students. They have to be interested in the intellectual substance of medicine, and they are committed to advancing our field forward. And our field is very broad. Okay? So the kind of student that we are looking for is a student, in fact, who wants very much to have the medicine in their future be better than medicine is today, and create the new knowledge, the implementation of that knowledge, and the dissemination of that knowledge so that it actually functions well. Mm-hmm. So what then would be then desirable traits for physicians if they have to engage well with individuals and they have to worry about the fact that health is more than just about their health care? Mm-hmm. Well, they have to be smart and they have to be knowledgeable, and that's the point that all of us will make, that you have to demonstrate that you are academically ready to succeed. Okay? That's a given. Okay? We have to be willing to change and adapt our practices with new knowledge. And we have to be involved in developing that new knowledge and implementing it and disseminating it. Okay? Or else I would be practicing. I graduated from medical school in 1977. It was the dark ages. I would still be practicing medicine that way. Okay? And I don't want to practice that medicine. I want to practice today's medicine. The last thing is we need to relate well to our patients, and relating is different than just being effective communicators. It is being ethical and effective communicators, is making sure that your patients can have genuine and honest relationships in which they can be themselves with you. Okay? And that's what's called patient-centered care. Everybody talks about patient-centered care. I would say that most of you will be training in doctor-centered care. Okay? And what you have to do is change your perspective. And when you look at the healthcare system at work and individual patient-physician relationships, what you should be looking at is, what does this look like from the patient side? Is this patient in a position where they're comfortable about being genuine about their problems? Is the discussion limited only to their health care, but does it also encompass their circumstances and their health? Okay? So if someone has asthma and all you're doing is changing medicines for that particular day, and you're not asking about their housing and their environment, then you are missing out on opportunities to, in fact, impact that person's lives tremendously. But you have to ask the open-ended question, and that's a learned trait. So you learn how to ask the questions that will allow you to understand your client's circumstances. If you do that enough, then you say, gee, there's a lot of unhappiness and injustice in the world, and so you become an advocate. And how do physicians then advocate for their patients? Well, the first thing they do, they practice client-centered care, which I just described to you. But they also have to understand local, state, national, international policy, because to the degree that everything in our environment, everything in our neighborhood actually impacts care, if you don't open the paper and you don't read about employment policy and immigration policy and education policy and workmen's compensation policy and workplace policy, you will not see the root causes of many of the health problems that we'll see today, and we will not be in a good position to address them. So we will only be able to treat them after they've become a problem and not prevent them. If you do that, then you're going to want to contribute to systemic change. And that generally involves talking to people who make policy. Terrific. It involves talking to people who make policy, and it involves people who make decisions in the government, whether it's local, national, state, or international. Okay? And you're always going to have to think upstream. That is, we can always address the problem if the patient comes in, and they will, in general, be satisfied that you have been able to do a good job in addressing their urgent problem for that day. But in some ways, if you want to prevent those problems, you have to think about what the root causes are and be able to say, I want to become an expert in the root causes of this illness, and I want to make that my career choice. Okay? So, if I already told you that most of the causes of health problems and illness in our society are actually due to our circumstances in which we live in and the behaviors in which we engage, you can see that traditional training for medicine that involves a lot of pre-med requirements like organic chemistry and physics and all that kind of stuff may not necessarily be relevant to those issues that are very, very important. So that we want you to come academically prepared, and we know that science, particularly the biology of life, is fundamental in having physicians understand their practice as well. It is very, very important that you also come prepared by thinking, how do I understand root causes of disease? How do I understand what promotes healthy communities? How do I understand how to implement that in my own community? Okay? So it involves opening up your eyes and broadening your education and broadening your life experiences outside the classroom as well. And so let's talk a little bit about the MCAS application. So how many of you are currently in the MCAS application phase? You're already applying to school, or just a few of you? Good, this is the audience I was hoping to have. So we're going to look at your MCAT scores and your academic transcripts and make a decision whether or not you're academically ready to start. Okay? That's all we're going to look at. And it's very good for the first 2 years. It predicts wonderfully the first 2 years of medical school. And it's a must. You must be academically ready to succeed. We're going to look at your activity sessions and the corresponding letters of recommendation to try to figure out, so what are the life experiences that you've engaged in that actually would enrich our learning environment? Because it's all about sharing your experiences. How are you living your life genuinely, out loud, and for the benefit of others? Okay? And then we're going to look at demographic information. We're going to look at personal statements, hoping to look for the kinds of personal qualities that we think are important for good practitioners of medicine. Okay? And that's actually the hardest one for us to judge. Okay? Because most of the information we get are from things you write, which are sort of self-reports, generally multi-edited and sometimes multi-authored. And some of those are letters from fans and people who hopefully know you well. So we take it that they are providing us with the right answer. But in some ways, one of the things that we rely on an interview is to try to decide, is the person who showed up the person who wrote the application? Do we see the same qualities as others have seen in them? Okay. So every school will also ask you, most schools will also ask you for some supplemental application. And I'm not sure whether you're going to be able to read it, but essentially the questions that we ask are relatively simple. They are, what kind of career in medicine are you interested in? How have you prepared yourself to succeed in this career up to this point? How will our medical school help you achieve that goal? And what unique voice will you add to our learning environment? Okay? It would be really, really good if your personal statement that you sent to every school and the answers to our questions sort of were coherent. We will look for that very, very much, okay? And it's not that we expect them to be the same. In fact, we don't want to cut and paste. But we want you to, in fact, what you're willing to share with others to be genuinely what you're interested in so that we can see the fit for our school. Okay? Good. So again, We're going to look for academic readiness. We're going to make a relatively simple decision with that. We're going to look for scholarly activities. We think that the way that you improve health is through scholarship. And scholarship involves discovery, involves education, involves integration, involves dissemination and education. All of those things. So we're going to look for evidence of scholarship in what you've done. Notice I'm not using that research word, okay? Even though we value research tremendously. If you read the news this week, a couple of Nobel Prizes came our way. We value discovery tremendously, okay? But it's not the only scholarship we value, because ultimately, if discovery is going to be useful, it requires education, integration, dissemination, and application. Most of you are going to take part in some club of some kind. And some of you might I'm going to use that one. How's that? And notice that I didn't write down when we were looking for leadership skills that you were president or you were chair or you were supreme being for that particular club, okay? What we're actually doing is actually trying to decide what are the leadership skills that you demonstrated. And most of the time, we're going to get it from your good letters that you've received, if they're written well, and that's what we hope. Okay? Because it's not about who chaired the committee, it's about whether that person, in fact, modeled the way for others. Okay? In fact, their qualities is what were good models or good examples of what their other values and qualities should be. That they challenged the existing process, that is, that they looked at the status quo and said, we're not satisfied with this, and we're willing to change it. That they created a team that worked better than individuals, that is, that everybody at the team was able to work at their best. That they were able to look towards the future and inspire a vision that was not theirs but shared by the whole team, and that they knew how to celebrate what they did. Now those are the qualities that you'll read about in Leadership Challenge, which is a program that's out of University of Santa Clara, a close neighbor of ours, that actually looks at, so what are the qualities of leaders that sort of transcend their title? That's what we're looking for, is people who model those qualities and live those qualities very well. We also realize that if we think the healthcare system is very unequal in this country, the educational system is even worse. Okay? And so we know that there are, where is it? That there are some of you and many of you in the applicant pool who in fact had barriers to achieving an excellent education. And barriers can come in very different ways, and we won't know about them until you let us know about them. Okay? So we need to hear about those barriers from you. Okay? And what we might hear from you is, who are your parents? I mean, were you, like me, the first one to go to college in your family? Okay? What was the quality of your high school education? How many hours a week did you have to work in order to support yourself that limited all the other activities that you had to do? Whether they had cultural barriers, geographical barriers, or prejudice barriers in order for you to get to all of your educational opportunities. What was the impact of stereotype threat on your academic performance? And do you have special family circumstances that meant that you weren't formally employed by your family, but in fact had to do an immense amount of work for them? All of those things are things that you can tell us about that we will in fact consider in the context of your performance in school. We won't make those up unless you tell us about them. So we want to hear those from you. And we want to see them in your essays and in your personal statements. So in my school, we get about 7,000 applications, and we interview about 450 individuals. We eventually make 180 offers, and we fill a class of 90. So it's a very selective process. And we generally take the 7,000 and we read all the completed applications and make a decision to interview based on academic readiness and life experiences. Okay? And we don't treat academic readiness as a continuum. You either are or you aren't as far as that decision. So if you get a 3.9 GPA versus a 3.8 GPA, you're not more academically ready. You're both academically ready. Yeah? The interview is where we rely for some of the personal qualities that we'll do. Okay? And we have the same kind of very highly structured interview as they have here at Davis, which we implemented about 3 years ago. And so there's different styles of interview. There's traditional, which is an open-ended conversation, sometimes with the open file, sometimes with a closed file. And then you can structure it, and structuring an interview means that you actually prescribe the questions and ask the same questions of everybody. You can prescribe the way the answers are rated by using Likert scale, grounding words that go from unacceptable to exceptional and describe the behaviors that you would see in between. Or the most highly structured one actually also times them and provides multiple assessments, and we call that the multiple mini-interview exercise. And every time you structure it, you make that observation more reliable and more valid, and in many ways, more fair. Okay? So if you actually look at those things that correlate with the usual assessment that we do of quality of education, of quality of your performance in your pre-clerkship time or your clerkship time or your clinical practice, the science GPA, the biology and physics GPA and the GPA, the biology and physics MCAT scores and the GPA, whether it's science or overall, predicts very well the performance during the traditional first 2 years of medical schools, which we call the pre-clerkship years, and don't predict any further. Okay? The verbal reasoning score of your MCAT and the multiple mini-interview score predicts very well clerkship performance. But if you want to predict further into the future, that is residency performance and actually practice performance, only this multiple mini-interview will do that. And so that's the reason why schools like our school and David's switched. Of interest is that it doesn't correlate with a lot of things that we ask you to do anyway, as you can read. Okay? But we use those because they help us evaluate your personal experiences. Okay? Because we believe that people who have sort of deep and reflective and sort of excellent personal experiences are willing to talk about them and share them with others should be part of our learning environment. So if you look at then the benefits of using this multiple assessment, which about 19% of schools in the US and Canada now use, and many of the schools in the West are switching to, you have multiple raters rather than one, so the impact of individual bias is dampened, so that you don't have 1 or 2 high-risk interviews, you have 10 low-risk interviews. Okay. It's structured, and I would add that structure, as I said before, adds to reliability of the data and validity and fairness. Most of the scenarios we ask you to discuss are not based on specific knowledge, they're based on general knowledge. And what we ask you to do is think through a problem and provide us with your solution clearly. We use rating scales that are normalized, that is, we have trouble with hawks and doves in there, just like everybody else, and so we have to make sure that everybody's scores tend to look the same eventually. But more importantly, we can address school-specific skills. And if you talk to physicians and ask them the question, what are the skills that we should select the next professionals for? Chances are they're going to tell you the same things. We want them to be able to critically think through problems and solve them. We want to be very effective communicators, and we want their behaviors and their values to be strongly based in a sense of ethics. And any school you go to, you do some semi-structured interviews, you will come up to those 3 top things. So ultimately, our committee decision is relatively straightforward. How will this candidate contribute to your school? How will this candidate benefit from your school? And it's got to be good things on both sides of that equation. Okay? Will accepting the candidate be in keeping with the mission of the school? How well do you think this candidate wants to do what we are best at and what we value the most? is the applicant academically ready to succeed? Mhm. Do they have the life experiences that will enrich the learning environment, and do they have the personal qualities that will characterize the best health professionals? And so we mostly discuss everything but academic performance in our committee decision, because we've already made that decision. We only interview those who we think are already academically ready. Okay? So what would I suggest you do? And I'm going to use the 5 dimensions of personal and social responsibility. And they're not mine, they're from the Association of American Colleges and Universities. And we look for people who strive to be really, really, really good at what they do. We take depth over breadth any day. Okay? So if you are really, really, really good at something, we are very interested in you, particularly something that is relevant to health. Okay? We think that you need to cultivate your personal and your academic integrity. Physicians have a lot of time in which they are working by themselves. And their honesty and their ability to be only thinking about their patients at all times has to play out in every aspect of their lives. It's very easy for physicians to take shortcuts, to take other considerations other than their patient's best interest, and it's very important that you cultivate a sense that your patient is your object, is the object of your work, and cultivate that integrity. We desire that you're contributing to a community that's larger than your own. Okay? When we care for patients, as I'm a liver transplant physician, when I care for my patients, I see patients from every community. And I need to know how people like to be treated who are of that community or that identity, who hold those values. And it's not that I become an expert at every community of the patients that I teach. There are 100 languages spoken in the homes of our first graders in Santa Clara County where I work. I'm not going to learn 100 languages, okay? But I am going to learn how to use an interpreter. And I am going to learn how to, in fact, understand that my patient doesn't want to be treated the way I want to be treated. They want to be treated the way they want to be treated. And so I need to find that out. And in order for me to find that out, I need to get to know who they are, not only as a patient, but who they are as a person, as a member of a family, as a member of a community, and as a member of an identity group. And we can all learn to do that well, and you can start now. Because you will, in fact, be in many, many service organizations in which the same things that I just told you about will be critical to your success of engaging someone in that community and making the best of your service for that person. And to the degree that you can do it, transfers very nicely to the way that you will work as a physician. And finally, we have to make very difficult decisions because we always work, particularly in my field, work in low resource settings, and we need to distribute. And so how do you distribute ethically? How do you make sure that you maximize the gain to all the stakeholders in a decision? How to make sure that you're always thinking not only about your patient, but it's about your patient's circumstances? It's very important that we develop a very strong ethical compass to guide us through those. Good. So, what should you do Monday morning? So I would say you need to get tailored advice. I can give you, as I said before, lots of general advice and how to become a good applicant and what we look for, et cetera. But in some ways, what you need is someone to look through your educational portfolio and the currency that you've developed for your next admissions decision and ask them the question, so how does that look like in comparison to other folks? Where are my strengths? How do I, in fact, show people that this is something that I'm very, very interested in? And how do I, in fact, transmit my desire to be an excellent physician by engaging in activities that demonstrate that I have transferable skills to do so? Okay? So I suggest that the best person to do that will be someone who can look at your life in some detail, look at your educational accomplishments in some detail, and give you some sound advice. Yeah. What we find in a similar pre-health conference that we run at Stanford is that many of you are worried if you're going to be able to afford medical school. And it's an important worry, okay? So make some time to speak to a financial aid officer. We actually have one of our financial aid officers here at the table today, and I know many other schools also brought their financial aid officer. We will, and most schools will give you enough money so that you can go to school. You're going to end up with loans, but in fact, loans are other people's money helping you get your education. So think of it as a good thing, okay? It's a good thing. Somebody's lending you money so you can get an education, and then you can pay it back, okay? Not a bad thing. I took a lot of loans. I paid off the loans. I make good money now. I'm okay. And you can do the same, okay? So the loans I took were probably worth more than, in real numbers, than what my parents' house was worth at that time, right? Scary. But doable, and doable within the confines of our careers. I mean, physicians in general aren't the wealthiest person in the community, but they generally live relatively comfortably. There's a couple of online sites that would be useful for you. One is aspiringdocs.org. It's a AAMC sponsored site. They're actually here. They have a tent, and you can go visit them. Nice people, okay? And some of it is to say it's going to be more general information about what you can do, but also some specific sort of tailored tools that you can use for looking at your own sort of background. The National Association of Advisors to the Health Profession has some similar good resources on their website. Finally, make sure your talk is your walk, okay? I mean, we are mostly going to be looking at how you acted and how you behaved and what you demonstrated rather than what you said on your application. And so what we're going to be looking at to make our interview decision is going to be your experience section. I read essays and I read questions, et cetera, but in some ways, if the essays paint a picture that looks like this and the experiences paint a picture that looks like this, we're going to go with this to make our decision. Okay? And you want this. Okay. Questions? Yes. How many what? How many do I get a day to read? One per application, right? Well, actually, we get 4 for our application. And we have readers that read them all. So we get 7,000 times 4, 28,000. Pretty cool, right? Yes.
When you read one of those essays,
They can't hear you.
when you read one of those essays, do you focus more on what they're talking about or how they present?
Yes and yes. And so what we actually look for those essays is your degree of self-awareness about yourself. If there's one thing that we train our readers to do as they're looking in those essays is how self-aware is this person about their own sort of candidacy for medical school. Yes. Wiggle your hands because I can't see them very well. Yeah. Yeah. We won't let you do that. Some schools let you do that, but we think it delays your application to every other school, and the chances that you'll actually be successful is pretty small. And so we have actually dropped our early decision program as a result. Yes. You're talking to the people in the back. No, they can't hear you. Really loud.
Do medical schools account for affirmative action?
Do medical schools what?
Account for affirmative action.
We, in fact, if you can look at a AAMC site that has the following table. GPA here, MCAT scores here, and the likelihood of acceptance by race and ethnicity. And what you will see is that every school nationally practices affirmative action. Yes. No, you got to talk really loud because they can't hear you in the back.
How does Stanford view transfer students, students who went to community college before they went to a four-year institution?
We have transfer students in our applicant pool and in our school and among our graduates. And we judge them in the same way we would judge everybody else. Yes, in the back.
Hi, I was afraid if we don't have a treatment advisor at our school, would you suggest anyone else that we speak with?
Yes, and so I think if you, correct me if I'm wrong for some of the advisors, but I think there are advisors available to you through both aspiring.org and through the naahp.org website.
Okay.
That will be willing, they have frequently asked questions and all that kind of stuff, but they also have direct links.
Great, thank you.
Is there anybody else? Yes, over there.
Some schools offer committee letters. How important is it that that you, like reviewing applicant, that you receive a letter that talks about that applicant in relation specifically to Stanford's mission?
So we're always going to make a mission-related decision, okay? That's how we do it. So we're going to look at, see, how do you fit with the kinds of things that we do? Your committee may actually be evaluating many other things in addition to the things that we're also interested in, okay? And so we will search not only in your committee letters, but in your individual letters from people, preferably who know you really, really well, okay? To look for the traits that we associate with good students, okay? So the answer is, it might help you if they actually write a good committee letter, but in some ways, we're going to look for people who have primary evidence of your qualities. Yes, say it loud. So he's asking about major, and major has no impact, right? Because in some ways, it doesn't really matter what you do. It matters that you do it very well, right? So we can figure that out. We know some schools are tougher than others, and we can figure that out. It's not a mystery. Okay? Yes?
My question is actually kind of regarding that, but how much do you take into account where people got their undergraduate education?
So does the school where you went to count? So what we know is some schools really give their grades away. They just give them away. And some schools are very tough to get a good grade in, okay? And we have that knowledge for us. And that's what we concentrate on, okay? Yes?
If you have research experience, what kind of skills do you look for?
So the question is about research skills, and what are we looking for? We expect that our students in whom their research is their sort of the unique sort of feature, where they achieve some depth, that they were able to work independently, that they were able to, in fact, run their own experiments, that they were able to, in fact, do things that were creative, and that they worked hard and for a long period of time. Okay? We don't expect a publication. We do expect a strong letter of support that addresses the kinds of skills that I just talked about. Yes?
Do you look at community college grades differently than university grades? Aside from looking at
So we do look at the continuum, and we want to make sure that people, when they present their transcript, that their transcript is that they've been able to succeed at every level, okay? And so what we want to make sure is that people can succeed in one setting but not in another. That's not so good for us, okay? So we need people who can succeed everywhere they go. It is important to us, but I must say that the likelihood of an applicant being a non-biology, chemistry, or psychology major is really pretty small. So although we eventually end up with more of those people than in our applicant pool, it's not like it's a huge number. Yes. You. So if the letter begins by the person took my physics 101 class and I didn't get to meet her very well, I'm not going to read that letter. I just stop at that sentence, okay? It's gone, because it's no better than your grade. If the letter begins by saying, this is how I know this person and this is how well I think of her, I'm going to read that letter. And what I would like for you to think about is the letters that are most critical for you are the ones that are related to your most significant experiences. And we will expect a letter for all of those. So if you tell me that you saved the world, I want the PI who helped you save it to write a letter for you. Okay? Yes. Is it true, she's saying? Way up back there.
Is it true that Stanford or some other medical schools don't like to accept their own undergrad students?
We take more Stanford undergraduates than from any other school. You do. Yes. So she's talking about the MD PhD program and what? What about? In our school, yes, but in many schools, you either can consider for one or the other, but not for both. We consider every MSTP applicant as an applicant for medical school as well. That's true, yes. Yeah. So it doesn't detract anything from your application. Yes. So I would place myself in the reader's chair when you write your experiences section. Tell me something I want to know about you, okay? Don't tell me stuff that you think I want to know. Tell me something that that would advance your application, okay? Describe things, describe how you learned, describe how you were changed by it, but don't just tell us that. Give us very specific examples of why those experiences were transformative for you. Okay? Tell us how you changed your course. Tell us how you changed what you did subsequently. And tell us what you've achieved and what remains in that community as a result of your work, or what remains in that lab as a result of your participation. If it's good, we'll read it. Yes. Shake your hands because so if you are applying to a research-intensive medical school that values scholarship, and I use scholarship, and I told you what the difference, what you have to demonstrate is that you've done some scholarship. Okay? And research is one of the scholarships. That is, the scholarship of discovery is one of the scholarships. But you better take what you've done and frame it in that way, and then you will, in fact, be attractive to us. But it's your job to do that, not our job to do that. Yes? So again, what we need to make sure is that when you were challenged in your coursework, that you were able to succeed, okay? And some people get a rough start, and we recognize that. But at some point, you have to demonstrate to us that the kind of amazing, intensive learning that you need to do in medical school, you've already done and you have succeeded in. Yes? They can't hear you. Actually, they both predict equally well in our model. So all overall GPA and science GPA predicts very nicely for us. Yes? I'm sorry, someone who's already been a physician and is applying to medical school? You know, it's about the applicant, it's not about their parents, I have to say, right? Yeah, 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 yeah. So you wouldn't be the first in your family to go to college if your parents were physicians, right? Yeah, yeah. I understand, but still, educated family, yeah. Yes. No. I guess I can, because I answered yes. So we talked about that, I think, already. Again, it really just depends on what you were able to achieve and what you did very well. Yes. I would say it's naive and it's self-centered. Naive means you don't really know what you're talking about. Those are the pitfalls. I mean, you got to be honest and you have to be sure that you're writing things that you're actually knowing about. Yes? I'm sorry, no, I was actually pointing to the person in the back. No, that one. No, there's three. 1, 2, 3. That one, you, with the tie. No, the one with the tie. My recommendation is you give them is you talk to your pre-health advisor and let your pre-health advisor give you some guidance about what is involved in a good letter. We actually have some general guidelines of that in our website. But you can get a document that says these are the kinds of things that you should be addressing in the letter and hand it in with your request to write the letter and let them go at it. Now you in the back. So we can't tell the difference in the transcript whether the course is online or on-site, right? We teach a lot of online sites. We teach an immense number of online courses. And when it comes in the transcript, everything. Statistics. Yeah. Yeah. So we'll know that those are, but you can't tell, if you took a course at Stanford, you can't tell whether it was on-site or online. Yeah. And that will only be more common in the future as we democratize our educational system. Yes. Yeah. So I talked about it, education, integration, implementation, dissemination, okay? So once you discover something, it takes about 20 years for a new medical discovery to be available in every one of our communities. If you can accelerate that, you're going to do something good. I can go back to you. Yeah. So the verbal reasoning predicts your clerkship performance. So it predicts your clerkship performance. So the biology and the physics predicts your pre-clerkship performance, the basic sciences of medicine. The verbal reasoning predicts your clerkship performance. So they have different uses in our system. And that's just not just us, that's everybody. Yes. I don't think that's a deal breaker either way for us. I mean, it's not something that's going to change our decision either way. If you're already focused on something and you knew that you wanted to do it, we're going to probably want to see some accomplishments in that area already. Sorry, you're going to have to tell me that again. How do I view what? Yeah.
So what happened maybe 5, 6 years ago, they've had that experiences, and now their academic performance is very, very different than their undergrad. How much do you weigh that undergrad?
We weigh both. Okay. We waive both every time. And we're trying to decide again is if there was a time when you had to do a very rigorous schedule and you performed very, very well, then we will consider you as an academically ready applicant. A whole bunch of upper level science classes at a time, some bioengineer, I mean, you know, not just one at a time, et cetera. That's what we're talking about. A year, a little bit more. Yeah, sure. We want to make sure that you can perform when you're being asked to perform at a very high level. I got to go. Thanks very much.